You know, doctors, here at Spinal Kinetics, we say, and we've seen a lot all across the country, how using Spinal Kinetics increases your external referrals. And a lot of doctors don't know how does that work? Well, it works the same way as if you're using any super highly professional service that assists you with determining what the patient has. So if I'm using Spinal Kinetics, I'm actually assessing something that a lot of the market does not understand, which is the spinal support ligament injury. The market understands the disc, but they don't even understand that the disc herniation by itself is generally a pre-existing condition. It's not been proven otherwise. So when you're in an auto injury, for example, there is no smart bomb of energy that just hits the disc. That smart bomb of energy has to go through a lot of other tissue before it hits the disc. So is that other tissue damaged? If it's not, then you're probably looking at a disc that's a pre-existing condition. So how does using that or understanding that help with a provider to get more referrals? Well, if you are the #1 doctor in your area for spinal ligament injuries, trust me, you can get a lot of referrals. You can get referrals from urgent care centers. You can get referrals from other medical doctors. If you're a medical doctor, you can get referrals from chiropractors. If you want to get referrals from pain management or start to work with pain management, you can get referrals. If you want to get referrals from attorneys, you can get referrals. You probably almost in the future could go out to the insurers and get referrals from them. Employers, get referrals from them. HR people, when their people are hurt on the job, get referrals from them. How? Well, in my experience, again, when a patient has a spinal injury, most of the injuries are damage to the ligaments. They're the worst injuries in the market today. By that, what I mean is they cause the first, fourth, and sixth leading cause of chronic pain and disability, depending on who you look for your research and reporting. Low back #1, neck #4, headaches #6. So if I'm understanding a condition that most of the market doesn't understand, and my expertise is really high in its understanding, I understand how to work it up, and the majority of the market does not, I have a very unique selling proposition. And that unique selling proposition is very easy to translate over into referrals. So I'll give you an example. The upper cervical injury will mimic every single symptom, can mimic every single symptom of a mild traumatic brain injury. So if I want to go out and I want to get more external referrals and I want to go to neurology or I want to go to the people that actually handle mild traumatic brain injuries, I have the easiest pitch in the world is this. Anyone that you have where the symptoms are not abating should be sent to me. Now here's why. In a mild traumatic brain injury clinical trajectory pattern, there's 6 patterns. There's 6 things that cause the patient to have symptoms. There's visual, there's balance, there's cognitive, there's behavioral, there's headaches, and a thing called the cervical profile, and the cervical profile is the most important part because it is the thing that will cause all the other symptoms. But if I poke you in the eye, you're going to have visual disturbances, but you're not going to have a cervical injury, right? If I pop your eardrum and I damage your inner ear, you may have balance difficulties, but you're not going to have a cervical injury. If you have cognitive dysfunction, it's not going to cause a cervical injury. If you have headaches, let's say they're hormonal headaches, it's not going to cause a cervical injury. But if you have a cervical injury, new or old, that basically is assisting, or especially new, I'm going to say, restate that as new, then that condition alone, if not understood and treated properly, can cause the patient to not get rid of the mild traumatic brain symptoms because the right thing is not being addressed. I can get referrals up left and right with that. Good doctors are going to be able to. If I go out to the attorneys and say, look, we treat not only the severe injuries that are found in MRI, but even more severe injuries that are not found in MRI. I'm going to get referrals. I'm going to be able to get in front of these people and explain to them what makes me unique. One of the things that I love, and one of the things that we're trying to do with Spinal Kinetics is really elevate the provider and elevate that provider. When you're elevated, if you're in the top 10% of what you do, you are going to get referrals. Now, if you're in the midline and you're just mid-range average, yeah, you may not experience what I'm saying as much as you could if you move to the front of the bell curve. And moving to the front of the bell curve is just understanding the condition better. It's just understanding, good, I have to understand what I'm treating. I don't care if you're a urologist, right? Okay, if you're in the top 10% of urologists and you basically can really get fast, efficient treatment results with anything that the patient, that a urology patient comes in with, you're going to get more referrals. You just are, right? So it's the same here. You can use it to get a lot more referrals. Some of you, your expertise has to come up, but that's not hard to do. And there's programs to do it. So it's not hard to do, but at Spinal Kinetics, we're evaluating a very unique condition. That unique condition in the acute injury phase causes all kinds of symptoms. Okay? When it's not managed properly, it causes chronicity, and the patient that walks in that says, look, I've been in chronic pain and I've had this accident, the pain goes on and off for me, I treated for a long time, and then it seemed to abate, and then I don't know, 3 years, 4 years, it wasn't really a problem. Now it's a problem again. Okay, what's the problem? The same condition that caused it 3 years ago is the same condition that's causing it now. So the more you understand that, the more you're putting yourself out in the front of the bell curve and the more referrals that you can gain. Because you should be the doctor. Doctors that understand this condition should be the busiest, highest paid doctors in the market. That's my stance on it. That's what I've always looked at it. These are the most significant injuries, and if you excel your expertise here, you will generate a lot of referrals. Now, is that something that happens in a day? No, probably not. Is that something that happens in a year? Yeah, absolutely. How about 2 years, 3 years? Yeah, how about the next decade? Unbelievable. So I'm very proud of the fact that providers that understand this are in a niche where there is not a lot of competition, and they can really take off as a result of it. And I'm very happy about that for the providers, because again, I think these providers should be the busiest and the highest paid providers in the country today.